even as states are coming out of the short-term crisis and still having to make some significant adjustments to come out of the short-term crisis, they really face some long-term challenges.
This is At Brookings, a weekly in-depth look at issues behind the news. This week, the budget crisis in the states.
Despite signs that an economic recovery is underway, many states are struggling to close budget gaps, balance their books, and provide much-needed services. With revenues declining and spending on education, healthcare, and pensions growing, many states are in trouble. Fellow Tracy Gordon examines the budget crisis for state governments.
States and local governments are really where the rubber meets the road. State and local governments provide most of what we think of as public services in this country. So education, healthcare, roads, infrastructure. State and local governments actually are responsible for most infrastructure spending in this country. They're responsible for most education spending. So they provide services that can critically shape the economy. They also are a large part of the economy. They employ 1 out of 7 workers. They represent about 12% of GDP. So they really are key players in our federalist system.
California and Illinois are 2 states that we know have had a rather difficult time. So what states are doing well, which states are doing not so well?
There are some states that were really hard hit by the housing crisis, that had seen their fortunes really rise before the recession, and then they fell very quickly. So I'm thinking of Nevada, Arizona, some of the Sun Belt states. And then there are states that have been having a tough time for a number of years. So Michigan, Rhode Island. Michigan's peak revenue year actually was 2000, so they've been on a downward trajectory. They've been cutting their general fund. And then there are states that have sort of a combination of these features, but in particular also some real political obstacles to making budget decisions. And so California, for example, is notorious for late budgets because of conflicts and disagreements over what to do. So in different states you have different kinds of responses in terms of how deep they're really getting into core spending areas. Nearly all the states have been cutting their budgets. Nearly all the states have had to go to where the money is, which is predominantly education and healthcare. In terms of the impact of those cuts on vulnerable populations, we haven't quite seen it yet, but only time will tell.
Well, it's common belief that states are required to balance the budgets. If a state doesn't balance its budget, or if the states do not, then what does this mean to the country writ large?
In some states, you're required to submit a balanced budget. The governor has to submit a balanced budget. The legislature has to propose a balanced budget. It's not quite the same thing as saying that you are not allowed to have a deficit at the end of the year. So it would be like at my household level if I said I was going to balance my budget, but I didn't quite live up to that promise. So it's a smaller number of states that actually have one of these ex post balanced budget requirements that say that you cannot have a deficit at the end of your fiscal year or carry it into the next fiscal year. Now, in reality, even states that have those strict requirements, there are ways that they can do that. The ultimate constraint is really, are credit markets willing to lend to states? And in general, no, they're not willing to lend to support a deficit on the operating side. They lend all the time to support investments in infrastructure or capital, but they generally don't like to lend money for current expenses.
In 2008, a town in California declared bankruptcy. If things get really bad and really dicey for a state government, can it declare bankruptcy too?
Currently, states can't declare bankruptcy. There's no state chapter of the Federal Bankruptcy Code. Municipalities can declare bankruptcy in about half of states, but sometimes they have to get state approval to do so. And there are proposals to add a chapter of the Bankruptcy Code for states. It's not clear where those are going. Some people see it as sort of a good idea because it would allow states to sort of reorganize their finances and get out from under looming pension and retiree health care obligations that they think threaten sort of the long-term sustainability of the state. The difficulty with these proposals is that it's hard to see how you overcome this sovereignty issue. So some people say, well, as long as it's voluntary, you're not impinging on state sovereignty because they wouldn't have to declare bankruptcy if they don't want to. But the real issue is that a bankruptcy judge, say in these municipal bankruptcies, has very limited power to sort of force parties to come to an agreement.
There's short-term challenges and long-term challenges.
Even before the recent financial crisis, the Government Accountability Office was saying that there were going to be significant shortfalls or differences between revenues and expenditures in the long term, say 50 years out. The financial crisis just made the short term worse by having this huge hole in state budgets because of the real loss in revenues. Those revenues are starting to come back, but the long-term trajectory hasn't changed. You've got rising healthcare costs, which are eating away not just at the Medicaid portion of budgets, but also the retiree healthcare benefits that a lot of these governments have to provide. And so just like before the crisis, now that we're coming out of the crisis, we still see that sort of ongoing gap. Those costs don't appear to be coming down anytime soon. So I think, at the state level, there was some hope that the federal government would take Medicaid off their backs, in particular the expensive part of Medicaid for the elderly and disabled, and it's looking like exactly the opposite is on the minds of federal policymakers, which is putting more of the risk onto states to manage those costs.
What does the future hold for our states?
States will come out of this. Already revenues are picking up. The last quarter of 2010 looked pretty good. We might still see some hard times at the local level and some ongoing job cuts at the local level, especially as they're dealing with cuts to state aid. I think, optimistically, I think this could be a period of innovation at the state and local level. There are certainly proposals at the federal level to give states more discretion in operating programs, proposals to block grant Medicaid, for example, which are quite scary to states because the way in which those funds would grow over time, again, would not keep up with the cost of providing services. But on the positive side, those proposals would give states a lot more room to try to innovate and come up with solutions to really the big policy challenges facing both state and federal governments, the rising costs of health care or difficulty in providing a really high quality, productive educational system. So I'm hoping that that states will continue to try to innovate, continue to try to show value for money, and that they will weather this storm and come out stronger.
Stay up to date with the latest research, learn about Brookings events, and search our directory of experts, all from your mobile device. To download Brookings for your BlackBerry, Android, iPhone, or iPad, go to brookings.edu/mobile.